Hi, welcome to this week's edition of Scrub Talk. We're going to feature our inpatient pharmacy. Our inpatient pharmacy supports around 12,000 patients per year, and they've got a very rigorous program that allows them to maintain very safe practices. With me is Tracy Meringue. Hi Tracy,
Hi.
How are you?
Good, how are you?
She is our Director of Pharmacy, and I'm really excited that she's able to join us this week on Scrub Talk. So tell me a little bit about your pharmacy.
Well, like Randy said, we service many different patients because we service many different departments in the hospital. So we take care of patients that come in through the emergency department, that have surgery and are upstairs, new moms that have babies, and also outpatients where some people will come in to have an injection and then go home, or an infusion and then go home. Or we have a very busy oncologist, so we do a lot of chemotherapy here. So we provide all the medications for those patients as well.
Talk to me a little bit more about some of the initiatives that we have here to provide safe patient medication practices.
Well, we put quite a few initiatives in place. We have things as easy as we have things like tall man lettering to provide a difference between look-alike, sound-alike medications. So some of the wording is capitalized to make it stand out and look different. As a group, we're working individually per patient to make sure that they're getting the best service, quality care, especially where med management is concerned in the pharmacy department's perspective. We are licensed in the state of Michigan to perform sterile IV compounding. What that means is that we've gone through a rigorous inspection of an outside independent agency that came in to see what our practices are, to make sure that we are meeting all compliance regulations when we are compounding medications that are going to be injected directly into your bloodstream as a patient. We administer many medications through an IV form for our patients, especially the ones that are sick for short periods of time, and even the people that come in for chronic IV infusions. The goal is that we don't introduce any contaminants into it. So we've gone through this rigorous inspection, and we're now fully licensed in the state of Michigan and recognize that we are fully compliant with all regulations to do sterile IV compounding.
But I want to hear from your staff members too. I think you have all of this great insight. But I see a pharmacist right over there, and I would love to hear a little bit from her on what she feels medication safety looks like.
In addition to all what Tracy has said, as a pharmacist, I do perform the independent double check every single day for all high-risk medication. And what that means that I myself double check or review the medication order and the dose and everything, and then another pharmacist will come around and review again. And that will minimize any potential errors.
That was great. Thank you so much for your input on medication safety. I love hearing from staff members.
Me too.
You know, I think we talk about all of these things that happen with medications inside the pharmacy. You know, and we have tracking, we have reconstitution, we have look-alike, sound-alike stuff, we have double checks. But at the point of delivery, how do we know that it gets to the patient correctly?
It's a good question. We have another safety feature that we have through our MedTech main information system, and it's called Bedside Medication Verification. And so what that is when you come into the hospital system, you are given a wristband, and on that wristband there's a barcode. And all of our medications have barcodes on them too. So when a nurse is going to administer a medication, they'll scan the wristband and then they'll scan the medication. If for any reason it might not be the right drug, or sometimes an order might change, so a dose might change, that will alert the nurse right at the time of delivery before they administer to the patient. So therefore they can see what may have happened and go and investigate that. So it's another safety feature that we have in place.
That's excellent. You know what? It sounds like from start to finish, there are so many different safety, and I know we didn't even take deep dives. That was just the tip of the iceberg, because I really do know some of the operations that are happening here. Thank you for keeping our patients safe each and every day. It's really great to see you and have you join me on Scrub Talk. And you know what? We're going to see you guys next week on Scrub Talk.